Welcome back. Have you been told that you're not a candidate for laser surgery? There may be another option to unlock visual freedom for you. Our next guests are committed to providing cutting-edge surgical innovations to correct some common eyesight problems. Dr. John Vukich is the founding doctor and refractive surgeon at Summit Eye Care of Wisconsin, and Dr. Nicholas Bruns is the lead optometrist. Little trouble with the name, but good morning, guys. It's great to see you. Let's talk a little bit first about LASIK, because a lot of people hear about it, but not sure what it is. So what is LASIK?
Yeah, LASIK is a fantastic procedure. It gives us the ability to correct your refractive errors, so being nearsightedness, farsighted, or astigmatism using a laser. So basically what we do is we take a laser and just gently reshape the cornea to match your contact lens prescription so that you can live your life without having glasses or contacts anymore.
Which is visual freedom.
Yes.
I'm sure a lot of people love it. But some people maybe have been told that they're not a candidate for LASIK. So why would somebody be told that they're not a candidate for it?
Well, typically what we're talking about is reshaping the cornea. And so doing so in a gentle fashion that essentially mimics what a contact lens would look like, but now it's permanent. But there's a limit to how much correction we can do. So if someone has very thick glasses or someone has a large correction, well, that corresponds to how much reshaping would need to be done, and it may not be physically compatible with what we can do. So often patients who have very thick glasses, the ones who are in actually the greatest need or would benefit the most, are told, we're sorry, but we can't do it. But it turns out that there are procedures that will correct their vision, and we have the ability to do that.
I know you do, because we've talked to some patients that you had who've been very thrilled with what has they've been able to do. So let's talk about this surgical innovation, and this is for people who potentially are not candidates for LASIK.
It's true. So like Dr. Vukich said, I mean, if you have a thin cornea or you just have anatomical limitations, we have something that would help. And there are advantages to EVO ICL over LASIK, even if you are a candidate for both. And so we really have a good overlap between both procedures, where some people might be better candidates for LASIK, some people might be better candidates for EVO ICL. And there's just, no way to tell until you come in and we do an evaluation. But there is something for almost everybody.
So we're looking at these diagrams here for EVO ICL. Explain what this is and what this can correct.
So it is fundamentally different in that it's additive. You can think of it as a very convenient contact lens. So it is a lens that resides within your eye. You can't see it or feel it, but it corrects your vision. And so because it doesn't involve removing any tissue, it's reversible. If for whatever reason you wanted to go back, it almost never happens, but we can take it out. Nothing has been done that can't be undone, but it does allow us to correct very high prescriptive corrections and do so in a way with very high optical quality.
One of the things I was fascinated to learn from the two of you is that after you put that in, you can actually do adjustments to it, right?
Different technology.
Oh, that's different.
Different
is
technology.
That LASIK?
No, that is the light adjustable lens, which we also offer.
Okay.
And so, yep, just another thing.
So that's different than EVO ICL.
Different, yes.
Okay. Okay. So this is something that you put in and you don't make adjustments to it afterward.
Correct. Yep.
Okay. Who's a good candidate for that then? Because you mentioned people with really, you need strong correction, that type of thing. So there's probably a lot of people, even people who are candidates for LASIK, who would be appropriate for this.
So people who are, candidates for LASIK, maybe your eyes are really dry and you have just sort of the scratchy feeling constantly. If you've been intolerant to contact lenses, LASIK can sometimes exacerbate those symptoms, and so for those individuals, we'd probably lean more towards EVO ICL because, again, we're not taking corneal tissue away, we're just adding something, so dryness is not that big of a deal. ICL comes with a little bit less glare at nighttime. The optical quality is as good, if not better, than LASIK. Not that LASIK is bad, LASIK's great too, but for people with higher levels of prescription, ICL tends to be a great option for them.
What's the recovery like with this procedure?
Almost instantaneous. It has been described as like putting a contact lens on, blinking, and you can see.
It's literally, that fast.
It is that fast. It takes about 4 minutes to do the procedure. It doesn't hurt, it's quick, and within just moments the vision is clear, and it stays clear.
Wow. Is it something then that can be corrective and last long term?
Oh, it'll last a lifetime.
Wow.
Now, what it doesn't do is it doesn't stop the hands of time. Okay, so there will be a point at which, in our mid-40s and beyond, we may need reading glasses. There will be points at which, things can change, but at the end of the day, we can really improve someone's quality of life.
Here's what I wonder is if I have eye issues, and the older I get, the more I do. I don't know exactly which procedure would be best for me. Would it be LASIK? Would it be the one we're talking about it today? Would it be one that we've talked about previously,
Sure.
where you can do corrections after you do the procedure? How do you determine which treatment or procedure is right for each patient?
It comes down to anatomy. You know, a lot of times it comes down to visual goals. And so the best thing I can tell somebody who's interested, maybe you have been told you're not a LASIK candidate, we have something that probably would be able to help, and we can at least consider it. So come on in, there's no charge for the evaluation. We take a look and we say, you're a candidate for X, Y, and Z, and here's why. And then you can make the decision on your own. So being informed, I think, is really, really important, and that starts with visiting the two of us.
And not giving up.
Yeah.
If you think that there's not an answer for your eyesight issues.
So we're coming into a time of year when people start thinking about, okay, we're flex spending, we may have something left over, there's some people will get year-end bonuses or what have you, and it's like, oh, can I do something nice for myself, or can I do something nice for my spouse or my significant other? And so this is the time of year when we become fairly busy, and because it makes sense. This is something you can do that's lasting, lifelong improvement, and it's a quality of life issue. We do LASIK on a regular basis, so we're very familiar with all of the refractive procedures. So it's not a matter of this is the only thing we do. We provide the entire spectrum of care and provide what is the best match for what you need.
So many great options. Thanks both of you for being here. We appreciate
Thank
it,
you.
and have a great weekend. So do you want to know more about EVO ICL? Is it right for you, or do you just want to find out more about what options you have for correcting your eyesight issues? Well, you can visit this website, summitiwi.com. You can also call this number for an appointment, and as they said, the consultation is free. It's 414-877-6414.